Good afternoon, everyone.
My
Welcome to
God.
November office hours. Can folks hear me okay? I got a yes in the chat, so I know the chat's working. Great. Thumbs up. Awesome.
Yes.
All right.
Yes, we can hear you.
All right. Wonderful. Thank you. Well, welcome to November office hours. This is our last series for the year. We do have a special office hours coming up in a couple of weeks, but outside of that, we're done for 2023. So, as usual, this is being recorded and it'll be up on our website. And any questions along the way, comments, we have the chat function, or you can unmute yourself and ask along the way. So here we go.
I got it. You're good.
All right, so we're going to go through some policy procedure, what's to come in the near future, some children's updates. Going to talk about the MAP plan of care upload requirements that's coming on. The CES tool, just a status check on that and what's coming forward with that. Appropriateness criteria for health home, quarterly trainings, and then a little bit of discussion around health home referrals. So the agenda is fairly light today, but as always, we can answer anything that comes up along the way. With that, Jess, did you want to do this slide or you want me to take it?
Sure, I can take it.
Okay.
So we don't have any policies to go over this month. We will be having some coming out in the new year. Most of them are just annual updates. That would be our non-health home billing policy, the quality and performance improvement policy. Some updates were made on that to reflect the updates that we saw from the Department of Health on their redesignation and their updated audit tool that they're going to be using. Our staffing qualifications, outreach and engagement, and transfer are all annual updates. We have updated our health home eligibility and appropriateness criteria policy. It was formerly our qualifying conditions policy with the updates to the appropriateness criteria, how we're going to track that for adults and children. And with the CES tool for the adult population, we have updated that one policy to encompass all of those things. So we have also updated the name. And these policies will be coming out sometime in December and reviewed in January. Does anybody have any questions on that? All right, well, keep your eye out for those updated policies. Again, they'll be coming out within the next 30 days and then reviewed at our January office hours. Just a couple of updates for children. It's not really updates, it's more of reminders. Just to let everybody know that the CANS 2.0 is live. It went live on November 15th. The booster trainings are in the UAS. They are not labeled booster trainings. It is course 1007 and 1300. Those two courses are required by December 6th. So if you do not complete them by the 6th of December, you will not be able to complete a CAMS. So those are right in the UAS. They're not in TCOM. And last I checked, they were not listed under required trainings yet, but they were going to be moving up, but they are required by the 6th. And again, they're not called booster trainings. Those are the two course numbers that you're going to be looking for. And the other thing that I just wanted to touch base on is that last month our quality notebooks went out, which also included our safety and crisis plans in there. And that was a new add to those quality notebooks. Just make sure that everyone's safety and crisis plan is up to date in NetSmart. The electronic version in NetSmart is what is reported to DataDen, and then that is what is pulled into our quality notebook that we get sent out to you. If you have any trouble saving that safety and crisis plan in NetSmart, please let us know so we can report that back to NetSmart to figure out what the issue is and we can move forward. Does anybody have any questions on those two items? All right, well, if you have any questions, you can email me or the health home.
Thank you, Jess. So just wanted to touch on the NetSmart Plan of Care upload requirements. That is something that all health home leads are required to start doing as of December. of this year. It's been in the makings over this past year predominantly. We've been working with NetSmart to get that ironed out for us for our health home, and they're in the process of finalizing that. But by doing so, there's a template that has to be lined up through the DOH template to the AHR, which is NetSmart, and then to MAP in order to be accepted to MAP. So some of the things that we have to do now that are on this slide weren't required or were not things in the past that were a thing. But as we move forward, they are going to be now required. And I know there was a note sent out a week or so ago to the network about it, but just wanted to touch on it. So primary language is one of them. So on the top right-hand corner of this slide would be your screenshot and the demographics. That's going to be now a required field. Gender identity is new and required. So that's down on the left of the screenshots. Preferred pronoun is new and required, and date of birth is now a required field that has to be put forth. So those are new things that if as you're getting into records and working with members and updating along the lines, please make sure that you get this information in there. Otherwise, well, number one, it's required, so it won't be able to move forward unless you've done it. But secondly, there are things that are going to be pulled for that Planet Care upload to MAP. The other thing that I wanted to touch on with this is there's also some history and risk factors that are requirements for the actual Planet Care itself in NetSmart. So this is now a thing that is going to be required. It's new for adults and children as well, and it's going to be required for adults and children. And really what we're looking for is just a brief summarization of what those history and risk factors are. So we've provided an example for an adult and a child here. That's what that might look like. It is something that's going to be required. As I mentioned, otherwise the Planet Care upload will not take. And that's an issue if it doesn't, because all Planet Cares will start to be, as of January of this coming year, if they're not up in MAP and showing and this information not being pulled, billing is going to be impacted for that particular individual for that Planet Care if it's not fully present in there by the spec docs. So that's why these things are happening and why we're doing that. Now, just so folks have an understanding, some of this is a big haul. And we express that concern with NetSmart. And what they've done is they've been able to come up with a pre-populating for these fields to reduce that depth of work initially. So for us to be able to start pulling that Planet Care upload in December, a lot of these fields that I just went over with are be pre-populated. But we're asking that folks, as you get in there moving forward, that you start to update those accordingly so that we can get the most valid information in there recorded and uploaded through MAP. So I just wanted to pause quick, just make sure there wasn't any questions or thought around this. It's a state requirement. The spec document is the DOH document that all health homes have to adhere to. And it's working with their EHRs to get it in there and active and functioning. So that's where it's coming from. And we just want to make sure that we're trying to do what we can as a lead to minimize any extra work as this starts to happen. And hence the push to try and get some generic wording in some of this initially so that folks aren't going and doing double work to get it going. Any thoughts, questions? Okay, well, we'll be starting to pull this as of December, and it's got to be up to 100% of records by January of 24. So it's got to be for all people enrolled that have an active Planet Care. The SES tool. I want to thank folks for everything you've done to try and get this started in November. The way things came down through fast and furious. We appreciate everybody and their willingness and flexibility to get this going. I know it's been clunky. I know there's been a lot of questions. We haven't had all the answers. We're trying to finalize that. The policy didn't come out until very late and from the state. So we're in the throes of finalizing ours internally. And it's going to be the health home eligibility and appropriateness policy, which was our formerly qualifying conditions policy. That will be the policy that we're going to be reviewing on December 14th during the special office hours, so that we can make sure folks have time to have a chance to ask questions and bring questions forward, and it's specific to that topic. We have the frequently asked questions document that's been provided by the state. There's been questions coming in. Please keep those questions coming in. And we'll do what we can to iron out anything that you're not sure of. And then we'll finalize that on our discussion on the 14th. This is found under the additional forms tab in NetSmart. So for the folks who haven't done one yet, that's where you can find that. And that's where we're at with this piece at the moment. We have a question in the chat. I just wanted to back up. History and risk factors. Does this need to be updated along with the demographic info by January as well? The intention is, as you move forward going into the charts, I mean, the sooner the better would be ideal, but the recommendation we're asking is if these things are pre-populated now so that we can start to upload as of December, as you're going into your charts each week, each month, if you can get those in and get them updated as you're going. Understanding that it would be a big lift to do it all at once for all the folks on your caseload. Does that help?
Hey, Travis.
Yes. Yeah.
Just on the history and risk factors, I just wanted to let everybody know that with the initial Plan of Care upload to MAP, we did work with NetSmart to put auto-populate a generic statement in there. So not everyone has to amend their care plan to put that in there. But as you go forward and amend your care plans, you are going to want to put actual relevant information in the history and risk factors. What's going to populate first is just a very generic statement that will allow the upload to MAP to occur.
Yes, thanks, Jess. Yeah, that's another thing we advocated for, because that would have been a huge undertaking for folks. So every little bit helps. So thank you for mentioning that as well, Jess. And then there was another question on record office hours on the 14th. Yes, absolutely. So anytime we do office hours or special office hours, we'll be recording that and putting that on our website, because we understand, we encourage every CMA to have representation, but if for some reason that can't happen on a particular time, that's why the recording's there for folks to be able to go back and reference. So absolutely, that will be put up. And I think that was the last question. Oh, Taylor answered it. Thank you. All right, great. So next steps for the CES tool, as of December, that is also going to be starting to be pulled and uploaded through MAP. So that's another thing that we have to do as lead health homes as of December. So we will be going back starting in the November month for any CES tools that were completed, and we'll be pulling that along with December moving forward. Now, the CES tool itself is not going to have a billing component tied to it at this time. We haven't heard that it's going to happen anytime soon. The way other things have been going on, I wouldn't be shocked if down the road that may be something that comes up in discussion. But for the time being, the CES tool is not going to be tied to billing as far as going to MAP to be able to bill monthly. Again, this tool is for adult health homes, and that is the next step for that. And then it's just one more reminder as far as new members enrolled on or after 11/1 of 23. And then it would be complete 12 months post enrollment for those folks, and every 6 months thereafter. And then for existing folks enrolled, it's at the time of their next reassessment. Any questions? Jess, anything you wanted to add to this that I didn't, or Taylor?
Yeah, I just wanted to touch on reporting for the CES tool. So by the time we have our special office hours on the 14th, we hope to have a comprehensive report for you guys for the CES tool. But for right now, if you guys log into DataDen, it's not on the navigation page, but if you scroll along the reports all the way on the bottom, all the way to the right, there is a report on the CES tool, and it'll show you all the members that you have completed one for. It's not very pretty at the moment, but like I said, by the time we do our special office hours, we hope to have one in there that'll give you guys, the members that have had the CES tool, the recommendation that they received, and all the logic in there to appropriately provide you with the timelines needed. But for right now, that is available to you just to see who you have done one for in DataDen.
Thanks, Taylor. And we're working diligently to have a final product as soon as we can for that. So ideally, by the 14th, we'd like to be able to have that as something that's a tool in your toolbox. So, so that you can look at that and have it readily available each month as you're going through things. Anything else on the CES tool at the moment, or appropriate criteria?
Hi, Travis. This is Tina.
Hi, Tina.
Hi, I just had a quick question in regards to the CES tool. It's my understanding we need to start to do those when the annual assessment and care plan are coming due. But we had a question come up. If we have somebody that we're thinking might be ready for discharge, is it okay for us to do the CES tool prior to the assessment and care plan due date? Does that make sense?
It does. I'm not
So
thinking go ahead, Jess. I'm
I
not
can
thinking
answer.
anywhere popping up on it where that would be an issue, but Jess, go ahead and take it, because Jess has thoroughly vetted the policy at this point.
Well, I don't know about thoroughly, but I'm trying to. So with that, if you have someone that's ready for graduation, you want to make sure that you're following regular graduation and regular discharge from Health Home. So there's nothing that you don't have to complete the CES tool. You would just, if they're ready to graduate, you would just graduate them out. You wouldn't do the tool to kind of force the hand of graduation, hoping that you would get the recommendation of discharge. If you have someone that's kind of ready to graduate and they're not in agreement with that, you would then wait until the CES tool was due, because once that's due, you can do it. And then if it recommends discharge, then you would follow policy to give them the 5235 so they could file a fair hearing if they wanted. It would just give you more backup and grounds to discharge. But if you are working with a member that's ready to graduate at any point in their enrollment, you would just go ahead and follow regular graduation and disenrollment from Health Home.
Okay. All right, great. Thank you so much.
Yep.
Yeah, thanks, Jess. And that would be generally something that would be leading up in your discussions with that person ideally. So it shouldn't be a shock and awe. I mean, usually, but I know there's circumstances where people will contest that. But yeah, another means to support that when the time is due for it to be completed. Anything else as far as questions or comments?
I had one question with regards to billing tied around that.
Yes.
So, individual is due November. We did the CES tool, says we have to discharge. Are we able to bill for that action?
For completing the CES tool?
For the CES tool, or are we taking it based on that we're billing them as part of the discharge process?
So even if you're discharging or whether you're doing any type of assessment, the actual conducting an assessment is not billable except for children on the children's side. So when you're doing, say you do the CES tool, and as long as you're providing a core service to that member and working, and obviously if it recommends discharge, part of your core service over the next 60 days is going to be graduation, then you can bill. If you do the CES tool and it recommends discharge, but then you don't provide a core service to that member, then you wouldn't be able to bill. So it has nothing to do kind of with the outcome of the tool or completing the tool itself. It just goes back to providing a billable core service for Health Home.
Thank you.
I think the FAQ has that lined out somewhere in all the, was it like 10 or 16 pages worth? But the core service is the key. having a billable core service.
This is Lori. I had to run to the ladies' room. My apologies. I might have missed this. But so if you do the CESS tool and your assessment and care plan, say you do the CESS tool the end of October because your care plan's due November 1st. If it's cited that the individual should be discharged, you still would need to do a new care plan for that 60 days, correct, to bill?
Yes, you should be
Right.
updating your
Right.
care plan and you should be putting in a graduation goal
Yeah.
right into your care plan.
Gotcha. Okay. That's what I thought. I just wanted to clarify.
Yeah, any assessment that would be a due up until that actual discharge, you'd want to follow a regular process as far as health home policy. All right, great questions. So we'll have more on the 14th, and at that point, we'll go through the whole policy for folks. Initial appropriateness criteria. So 12/1, that's going to be the target go live date for the state. And as of February of next year, that's going to start to impact billing if this particular action isn't completed for members. And this will be something that we have to report on for adults and children. And it's something that's a new thing as far as the requirement to the state to expand on this. And the additional forms in NetSmart, that is going to be live as of the 1st. So there's an adult eligibility assessment and a children's eligibility appropriateness assessment as well. So they're each identified separately under the additional forms. You won't see it yet, but you will see it on the 1st of December. And that's where you'll be entering in for any new person coming through for appropriateness and consideration for health home. Any questions on that? I jumped ahead to the next one. Any questions on that as far as that goes for appropriateness criteria? Okay, well, you know where we are if you have any. Jess, we're back to you.
Hello, I know I'd mentioned this previously, but I just wanted to mention it one more time to the network, is that when we move into 2024, we're actually going to be offering more consistent training rather than just one-off kind of trainings or as needed. So we'll move more to a schedule base. So most of the children's side knows this because I've been doing a lot of HCBS trainings, but we're also going to be adding some plan of care trainings for the children's population and the adult population. We're also going to be working on a graduation training, and this kind of stems from the CESS tool and to be graduating more people out. And then it came up that when we onboard CMAs, we kind of go through a soup to nuts overview of policy and we look at NetSmart, and that's really a one and done kind of training. And then as our CMAs hire new staff, they're then responsible for training those staff and then, moving on. So it was recommended that some of our CMAs that have been with us from the very beginning have not had one of those trainings in a very, very long time. And there's also so much that has changed with those trainings, with workflow and policy. So we are going to be offering an abbreviated version of kind of our what we call an onboarding training, but it really will be a policy and workflow overview with some NetSmart tied in there. So that would be helpful to staff that just want a refresher on health home from kind of outreach to discharge, or if you have new staff and you want them to attend. All of these trainings will be held virtually. However, if any of your CMAs would like an in-person training for any of these, just let me know and we will make accommodations to come out to your CMA and offer a training. Does anybody have any questions?
Jess, I was just going to add too, we try to send out trainings to be offered that are coming from different sources and mechanisms. So we'll continue that as well, just as a supplement to this, so we can bolster opportunities for folks.
Yes, that'll all still be happening. These will just be ones specifically given by AHI. So if your CMA wants an in-person training, feel free to email me and we can get that scheduled.
All right, thank you, Jess. Health home referrals. I just wanted to take a moment just to touch on that. We've been getting a number of referrals coming through transfers, through the bottom up process, CBOs, other organizations, and they've been coming incomplete in many instances. And I just wanted to pause and let folks know that the health home is going to start to kick back referrals that are incomplete. In particular, those that, we know that's been with certain organizations, or I should say all organizations, and they're looking to transfer an individual and it's coming through with little to nothing on the referral. That's not helpful, number one, for the health home, and number two, for the agency receiving that new person coming on to do a warm handoff. So just wanted to put out there that we will be kicking it back to the referral source, asking for more information to complete as much as possible, understanding that there's going to be certain information at times that is just not available. But when it's just coming with the person's name and date of birth and not much else, that doesn't help. So we really stress that folks try to complete as much as possible. And I don't want people to be shocked if they start getting referrals coming back to the source asking for more information, because we track and monitor this. And the other thing that's coming up as we're going through our OMEG audit is they're looking for the referral source, what type of referral it was, how that information came in. So that gets looked at from OMEG even. So all the more reason we want to make sure we're dotting the I's, crossing the T's. So just a little bit more scrutiny on those referrals coming in.
Hey, Travis,
Yes.
this is Jackie Jackson.
Hi,
So, occasionally we get referrals from AHI and we face the same issues that you have, where we're not getting enough information or all the information that we need to reach out to the potential client. So I guess, when I get a referral that I'm going to send back and it was from AHI, I'm not doing additional work to send it back to you with more information. I'm sending it back how I received it.
Yeah, I appreciate that, Jackie. This is across the board. So this is inclusive of our internal referrals from AHI, the lead health home, referrals getting looked at closer. So this is going to be across the board for everybody
Okay.
involved.
Great.
I'm just letting the network know that we're doing this as a network.
Sure.
So, it doesn't exclude our internal CMA. It doesn't exclude our referral coordinator. We're looking at this more closely as we go forward.
Right. And I mean, sometimes we give you folks referrals because, we get them through the emergency room or such, and we only have certain information. So I guess that's something we can kind of hammer out together at some point.
Yeah, I'd ideally, and we're not even close to that at this point, but I'd ideally envision at some point an electronic referral that you got to complete certain things in order for it to process.
Sure.
We're just not there yet, but in my
Yeah.
vision, I'd like to see that at some point. So hopefully some point down the road here, we can get to that, because I think it'd be much
That's-
more efficient, and it would
Yep,
be,
that's a great idea.
it
Yep.
would auto-correct a lot of the stuff that, people may be thinking or saying behind the scenes right now as I'm bringing this up. So,
Right.
nobody's exempt from this. We've all, to some level or another, when we've done a referral or processed one, pushed it through or tried to push it through. So we just need to look at it more diligently.
Right.
Thank you for that. I appreciate it.
You're welcome. Thank you.
Yep. Anything else around referrals anybody had? Okay. Lastly, today, I just wanted to mention to folks, we've got 2 more organizations in the hopper now going through to become providers. The Open Door, which is located in Glens Falls in Warren County. They are an organization that has really been around the Glens Falls area, Warren County area for a long time, providing services to adults in need, shelter services, food, all types of different programming that they are offering. Oh, we got somebody on speaker here. And really excited for them to come on. So they're going through the process right now, and they would be looking at adults for Warren County. And then Unlimited Potential, they're actually Northern Rivers, fall under their umbrella. They're located in Saratoga County, and they're interested in becoming an adult provider in Saratoga County. So they're going through it right now and looking to get down that path. And they do some like support employment type work. They do a lot of coordination in other realms for individuals that are developmentally disabled, behavioral health, mental health population. So they're excited to come on board, and you know, once they get through this process, we'll get them joining our office hours as well. People USA is continuing their application process. I've just been in touch with them again recently, and they just had to go through some other things because they're actually out of the area. They're located out in the Poughkeepsie region, but they have Warren County location where they provide mental health services near Glen Falls Hospital. And it's just a matter of getting them linked to our region, and because they actually provide health home services out of the Poughkeepsie area as well. And then St. Joseph Rehabilitation Centers, they're continuing to be on a pending status right now. They're interested in going for health home services, but they're doing some work with citizens advocates. I think some of you who are up north know that. They've done some sort of affiliation between the two organizations. So there's been some priority on that over the last handful of months. But they are very much interested in continuing to pursue health home once they get to a point where they're working through some of that affiliation that they've been doing with citizen advocates. So we're excited about that. Network continues to grow. There's clearly a need out there for folks who need services, both adults and children. And we're excited that we can continue to grow and support those needs. That was it. I don't know if anybody had any questions or other things they wanted to talk about. All right. Well, as always, thank you for your time and
Travis.
everything that you do. Yes.
Sorry, there's a question in the chat from Jessica Casey about the NetSmart reports.
Yes.
Jessica, let me know. They did get back to me, and I can now see the reports, but it is the new reporting feature that they put in there. But let me know if you guys as the end user can't see it, because it may be that they may have just turned it on for administrators. So definitely shoot me an email if you are still having trouble.
Thanks, Taylor. Check the chat once more. Sorry, Jessica, I was going through it and I didn't catch your question. Any other questions or thoughts anybody had? All right, as I was starting to say, thank you again, and thank you for everything you do day in and day out. And I hope everybody has a nice, happy holiday season coming up. And for those of you who can make it on the 14th of December, we'll talk with you then. Take care, everyone.